So again, just digging back into the challenges that we've discussed, they need a collaborative effort for especially the communities that are under-resourced. So,
Mhm.
what are some of the some areas of possible collaborations with stakeholders to support
Yeah.
these communities, the low-resource communities, to actually meet the goals of eliminating cervical cancer?
Yeah. One easy one is, really public-private partnerships, right? So I think the government has a critical role, like I just mentioned, things like providing insurance or access to treatment, having the government leaders, work with, organizations like Gavi in the vaccination. It really needs to work with the government. But then, being able to implement that, the ministries of health sometimes have to really partner with private sector, the private sector. And I know you interviewed Lacey in a good example of that in Rwanda, where Lacey is partnering with the government, and is just doing such amazing work there. So I think that public-private partnerships and collaborations like that are really, really, really important. The second one, which I think really is critical, we just shared about the men. I highlighted the example of the king in Ghana. So I really think that you have to partner with community-based organizations or leaders. You know, um, the king, think about religious leaders
Mhm.
like imams or pastors. Um, I'll give you an example, like in some countries where the cervical cancer, screening and vaccination completely goes very well intentioned by the government, but quickly becomes a problem because it runs into the whole idea of misinformation. Because why? They didn't get these leaders to be critical partners in
Mhm.
this, right? So once you start doing that, you have to talk to these people and get their buy-in into this so that they become your voice. Because by the way, the community people respect this. When a pastor says something in church, most people, the men and the women alike, they listen to that, right? So, and I'll give you an example, just a quick example. So when we're in the White House talking about how to improve on vaccination for young girls. One of the barriers that somebody came up with was saying that while doing this in Nigeria, they found out that, in East Africa, they found out that, some of the girls don't go to school, right? And the school is really where a lot of the vaccination happens. Um, you know, so the girls stay at home, they go to farm. There's a cultures like that, right? So they don't go to school. So then what else do you do? So, one solution there is actually to go to the cultural king, the king or the village or the tribe. If you get their buy-in, then, it's gonna make those girls, you're gonna be or go to church, go to the culture, go to church or go to the mosque, right? If you make partnerships with these people, you don't have to only go to school, right? You can overcome that barrier and meet your 90% target that you want to have, for the vaccination. So yeah, so partnering with community-based organizations and leaders is really, really, really important. And then obviously the cross collaborations among oncology health professionals, from prevention all the way to diagnosis, treatment, and palliative care. You really have to have the collaborative multidisciplinary team that works on these things.